Should you be worried about your collarbone popping in and out of place? I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education, information, and commentary on all sorts of sports and exercise injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. I get a lot of questions on my website and on my YouTube channels about the sternoclavicular joint, the joint really between the inside of your collarbone and your breastbone, your sternum. And it can be from a person that basically gets hit or falls and it pops out of place but stays out of place. What should they do about that? A sternoclavicular dislocation. But what I don't get as much of, but is obviously or honestly just as big of a problem, is when it keeps popping in and out of place, what we call sternoclavicular joint instability. Is that a big deal? Well, in this week's Ask Dr. Geier video, I want to talk about that exact question in somebody dealing with an unstable collarbone. Lars asks, "My left collarbone is popping out whenever I lift my arm over the head. It pops back in when I take my arm down. I had no accident or injury, and I have no pain so far. I saw 2 doctors, and they've both never seen this before. They only said, rest for a couple of weeks and it will heal. After 3 months, I still have this problem. Should I be worried? I heard that the cartilage can wear down, and I could have problems long term. I really want to go back to the gym, but I'm currently too worried about damaging my sternoclavicular joint even more. Thanks for your help." Well, Lars, that's a terrific question, and I don't know that there's an easy answer to the long-term issue. I'll get to that. But before I answer your question about is this a big deal or not, let's talk about what that is. So basically the collarbone, it obviously attaches over at the shoulder, but then it comes across to your sternum, your breastbone. And again, a lot of people can get traumatic dislocations of that. They can pop out toward the front, they can pop out towards the back. Big important discussion, and I've recorded videos on that subject before. But what I want to talk about is what Lars is experiencing, where for whatever reason it just pops back and forth in and out of place, usually pops out forward in and out of place with normal arm motions. It could be reaching up overhead, it could be doing push-ups, but something like that triggers that. Now, that you can see that in people that are quote-unquote loose jointed, or what we call have ligamentous laxity for whatever reason, some genetic disorder or something like that. You can occasionally see this recurrent instability of that SC joint after a traumatic event where it pops in and out of place, but it can happen spontaneously, again due to genetics or other things. I guess the easiest answer to Lars' question is no. As orthopedic surgeons, we typically don't worry much about that. If people can do what they want to do and it isn't causing a lot of problems, have at it. Could it lead to arthritis at that joint right at your breastbone over time? In theory, yes, that's true, and there are some things that can be done about that, but I don't know that that's as big of a concern as doing a monster surgery to stabilize that joint. To do a surgery, you'd basically have to make an incision right there and pass a tendon or a tendon graft, if you used a cadaver graft, through drill holes made right there. And the trick with that is that there's really bad things under your breastbone. Obviously, there's the big blood vessels off the heart and your trachea, your airway, your esophagus, some nerves and things that are really, really worrisome. And so that is not, those aren't likely events, but they're very, very serious should they occur. So if somebody doesn't really need surgery, we usually say, hey, just leave it alone. For somebody with that, we might try something like physical therapy to strengthen all the muscles around the shoulder and upper back and chest to try to get back to normal activities. It may not eliminate the popping, but any kind of uncomfortable sensations or weakness or something like that, it could improve it. It might help you get back to physical activities, whatever your sport or exercise is, especially if it's an overhead sport. So I guess at the end of the day, I would argue it's usually not a big deal. Are there surgeries that could potentially treat it? Yes, and that would be something to discuss with the surgeon. You're talking about a low risk, but if it happens, fairly serious complication for something that, it depends on how much it's really bothering you. Most people with that instability, it's one of these annoying little things maybe, but it's not something that limits them very much. Do you have a sternoclavicular joint issue, be it a dislocation or subluxation, or it's unstable, it pops in and out of place? I'd love to hear your experience. What did you do about it? How did you treat it? What did your doctor tell you? Below this video, share your experience, share your thoughts. I'd love to read it, and I know readers all over the world would love to read it too. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my YouTube channel. There's a button in the upper right corner of this page. Click subscribe. I record a couple of these videos every single week and they'll get delivered directly to you. Thank you so much for watching. I hope this was helpful. If you do have sternoclavicular joint instability, if you know somebody that has that problem, please share this video with them. And I look forward to seeing you, very much look forward to seeing you right here next time.